right on the US-Mexico border. We have people from Mexico, we have people from Asia. We have a very large refugee program. We actually are one of the biggest areas where refugees are resettled in the whole US. So we have people from Africa, et cetera. So foreign-born people, TB is still very, very common in most parts of the world.
In the global concerns about tuberculosis, drug resistance is a major problem. There's a lot of drug-resistant TB, and it's growing rapidly. There are patients now actually who have tuberculosis that's resistant to every drug that we have. We've developed in San Diego a lot of expertise about the genetics of TB in particular. So I started thinking about how we could apply the genetics of TB to the problem of diagnosing drug resistance. And we came up with several ways to diagnose drug-resistant TB rapidly. The reason it's important to diagnose drug resistance rapidly is that over the years, we've learned that TB bugs have the capacity to become resistant fairly quickly. If you treat someone with drugs to which their bugs are resistant, they remain infectious. So they keep spreading TB, and they spread drug-resistant TB. So it's a double disaster. And in order to combat that, instead of treating TB with one drug, if we treat with two drugs, they're resistant to one, the other one will cover it. 3 is better, and 4 is even better. That's why rapid diagnostics are important. They're important in saving lives, they're important in reducing drug resistance.
One of the things that is a key strategy for tuberculosis is directly observed therapy. If you develop TB, you would see us in your home right now, 5 days a week, watching you take your medication. We're working with UCSD to do some studies around using mobile technology for directly observed therapy. But right now we're using, it's called video DOT. You videotape yourself, you send it in, we can watch it, timestamp, date stamp. And we're also doing something we call WADOT, wireless DOT, where it's actually an ingestible sensor that is over-encapsulated on a tablet. You take your TB meds, we can watch it in our office and it shows up like a bar graph. Pill number 1, pill number 2, and we can actually, again, date stamp, time stamp, and we can see you doing that.
We've developed this standardized treatment to treat tuberculosis, and right now it's 4 drugs for 2 months and then 2 drugs for 4 months. In San Diego, those 4 drugs work very, very well. More than 96% of patients are cured with those 4 drugs followed by the 2 drugs.
We really take this whole patient-centered idea to heart, and the nurses who work in the field with the patients, the outreach workers who supply their directly observed therapy every day, I'm really proud that they're focused on exactly what our patients need, that they've accepted all these new innovative things and really try to see how is that helping our patient, how are we doing this a little bit better.